There comes a point in life when your body quietly changes, even if you don't notice it. You may wake up feeling the same, you may take the same morning walk, enjoy the same breakfast, and swallow the same medications you've been taking for years. Everything feels familiar, but deep inside your body, something important is different. Your liver processes medications more slowly than it once did. Your kidneys don't filter as efficiently. Your blood vessels become less flexible, and your heart works a little harder with every passing year. None of this happens overnight. It happens gradually, almost silently, and that's exactly why so many people never realize that the medication they've trusted for years may no longer affect them the same way after the age of 60. Now, before we go any further, I want to make something absolutely clear. This video is not about telling you to stop taking your medications. In fact, stopping certain medications suddenly can be dangerous. The purpose of today's discussion is something entirely different. It's about helping you understand how aging changes the way your body responds to medicine so you can have better conversations with your doctor and make more informed decisions about your health. Welcome to my channel. Here we focus on practical, science-based health information designed especially for adults over 50 and beyond. My goal isn't to create fear. My goal is to help you understand what is happening inside your body in a way that's easy to follow and useful in everyday life. Think about this for a moment. Imagine two people who are both 70 years old. They have similar lifestyles, similar diets, and even take many of the same medications. One of them has every prescription reviewed regularly with their healthcare provider. The other simply continues refilling the same medications year after year because nothing seems obviously wrong. 5 years later, one person continues living independently with few complications, while the other begins experiencing dizziness, unstable blood pressure, fatigue, or even a cardiovascular event. The difference isn't always the medication itself. Often, it's the fact that one person's treatment evolved with their changing body while the others did not. One of the biggest myths about aging is that if a medication worked well 10 years ago, it must still be the best choice today. Unfortunately, medicine doesn't work that way. Your body at 70 is not the same body you had at 50. Muscle mass decreases, body water changes, fat distribution shifts, liver enzymes may slow down, kidney function naturally declines with age, even in healthy adults. All of these changes influence how medications are absorbed, distributed, broken down, and removed from the body. Imagine pouring water through a brand new coffee filter. It flows quickly and efficiently. Now imagine using the same filter after years of use. It still works, but much more slowly. That's a simple way to think about how aging can affect your body's ability to process certain medications. Drugs may stay in your system longer, their effects may become stronger, and side effects that never bothered you before can suddenly become much more noticeable. This is especially important when it comes to your heart and blood vessels. As we age, our arteries naturally become stiffer, blood pressure often rises, and the cardiovascular system becomes less forgiving of sudden changes. A medication that slightly increases blood pressure or affects circulation may have little impact in a younger adult, but in someone over 60, that same effect can become much more significant. That's why regular medication reviews are considered an important part of healthy aging. Over the next few minutes, we're going to look at 5 common types of medications that deserve a second look after 60. These medicines help millions of people every day, and many remain valuable when used correctly. But under certain circumstances, they may also increase cardiovascular risk if they are continued without regular reassessment. Understanding why that happens could help you ask the right questions, avoid unnecessary complications, and ultimately protect both your heart and your long-term health. The first medication group we need to discuss is one that almost everyone has used at some point in life, whether it's for arthritis, back pain, knee pain, or a stubborn headache. These medicines are often the first thing people reach for. I'm talking about non-steroidal anti-inflammatory drugs, commonly known as NSAIDs. This group includes medications such as ibuprofen, naproxen, and diclofenac. There's no question that these medicines can be extremely effective. They reduce pain, decrease inflammation, and help people stay active. For someone dealing with chronic joint pain, they can make everyday life much more comfortable. But after the age of 60, the way these medications affect the body deserves much closer attention. Here's why. Your kidneys perform one of the most important jobs in your body. Every minute, they filter your blood, remove waste products, balance fluids, and help regulate blood pressure. When you're younger, healthy kidneys have a remarkable ability to adapt. But as we grow older, kidney function naturally declines, even in people who have never been diagnosed with kidney disease. NSAIDs work by blocking enzymes that produce inflammatory chemicals. That's what helps reduce pain. However, those same enzymes also help maintain healthy blood flow to the kidneys. When they're blocked for long periods, blood flow to the kidneys may decrease. For a healthy young adult using these medications occasionally, this usually isn't a major problem. But in an older adult, especially someone with high blood pressure, diabetes, or heart disease, the impact can become much more significant. Think of your kidneys as the filtration plant for an entire city. If less water reaches the plant, it can't do its job as efficiently. Waste begins to build up, fluid balance changes, and pressure throughout the system starts increasing. That's exactly what can happen inside the body. When kidney function is affected, the body may begin retaining extra sodium and water. That extra fluid has to go somewhere, and much of it remains in your circulation. Suddenly, your heart has to pump against greater volume and higher pressure. Imagine carrying a backpack that becomes a little heavier every day. At first, you hardly notice it, but after weeks or months, that extra weight begins putting stress on your back, your knees, and your energy levels. Your heart experiences something similar when it's forced to pump against increased fluid and higher blood pressure. The challenge is that this process is usually silent. You don't feel your blood pressure slowly increasing. You don't feel your kidneys working harder. You simply continue taking the medication because your joints hurt less, while the cardiovascular system quietly carries the extra burden. This doesn't mean you should avoid NSAIDs altogether. For many people, they remain an important part of pain management. The key is using them wisely. Short-term use for an injury or temporary flare-up is very different from taking them every single day for years without reviewing whether they're still the safest option. If you're over 60 and rely on these medications regularly, it's worth discussing them with your healthcare provider. Sometimes a lower dose, shorter treatment period, physical therapy, weight management, or another pain management strategy may provide similar relief with less long-term risk. Remember, the goal isn't to live with unnecessary pain. The goal is to manage pain while also protecting your heart, your kidneys, and your overall health for the years ahead. Now let's move to the second medication group, and this one often surprises people because it isn't taken for pain or heart problems. It's taken to make people feel better after eating. Millions of adults use these medications every day to relieve acid reflux, heartburn, or stomach irritation. They belong to a group called proton pump inhibitors, often shortened to PPIs. Common examples include omeprazole, pantoprazole, esomeprazole, and lansoprazole. For many patients, these medications are extremely effective. They reduce stomach acid, allow ulcers to heal, and provide tremendous relief from chronic acid reflux. In the right situation, they can dramatically improve quality of life. But like many medications, what begins as a short-term treatment sometimes becomes a long-term habit without anyone asking whether it's still necessary. To understand why this matters, we first need to understand why your stomach produces acid in the first place. Many people think stomach acid is simply something that causes heartburn. In reality, stomach acid performs several essential jobs. It helps break down food, destroys harmful bacteria that enter with meals, and allows your body to absorb important nutrients. Without enough stomach acid, your digestive system becomes less efficient, especially over many months or years. One nutrient that deserves special attention is vitamin B12. This vitamin plays a critical role in keeping your brain, nerves, and blood cells healthy. Long-term reduction of stomach acid may decrease your body's ability to absorb B12 efficiently. Over time, low B12 levels can contribute to fatigue, poor concentration, numbness in the hands and feet, balance problems, and memory changes. Many older adults assume these symptoms are simply part of aging when, in some cases, a nutritional deficiency may also be playing a role. Magnesium is another important nutrient. Your heart depends on magnesium to maintain a healthy rhythm, and your muscles need it to function properly. Low magnesium levels have been linked to muscle cramps, weakness, irregular heartbeats, and fatigue. Although not everyone taking a PPI develops low magnesium, the risk becomes more relevant with long-term use, particularly in older adults or those taking several medications. Calcium absorption may also be affected in some individuals. Calcium isn't just important for strong bones. Your muscles, including your heart muscle, rely on healthy calcium balance to function normally. Combined with age related bone loss, reduced calcium absorption may increase the risk of fractures in some older adults, especially if other risk factors are present. Here's another important point that many people never hear. Sometimes the original reason for starting a PPI no longer exists. Perhaps it was prescribed during a hospital stay. Maybe it was given while taking another medication that irritated the stomach. The problem was temporary, but the prescription continued for years because it was simply renewed at every appointment. This happens more often than most people realize. That doesn't mean everyone should stop taking acid reducing medication. Some people truly need long term treatment, and for them, the benefits clearly outweigh the risks. The important message is that long term medications should be reviewed periodically rather than continued automatically. If you've been taking one of these medications for several years, it's worth asking your healthcare provider a few simple questions. Do I still need this medication? Is my current dose still appropriate? Would monitoring my vitamin B12 or magnesium levels be helpful? Are there lifestyle changes that might reduce my symptoms enough to lower the dose? Sometimes the answer is yes, sometimes it's no. But asking those questions helps ensure your treatment continues to match the body you have today, not the body you had 10 years ago. And that's exactly what healthy aging is all about. Not avoiding medications that help you, but making sure every medication continues working in your favor instead of quietly creating new problems over time. Now, let's talk about another group of medications that many people over 60 use, sometimes for years, without realizing how much their body has changed. These are medications prescribed for anxiety, panic attacks, or difficulty sleeping. Common examples include lorazepam, diazepam, alprazolam, and clonazepam. There's no doubt that these medications can be helpful in the right situation. They can calm severe anxiety, improve short term sleep problems, and help people through difficult periods in life. But the challenge begins when a medication that was meant for short term use quietly becomes part of someone's nightly routine for months or even years. Here's why that matters. As we age, the brain becomes more sensitive to medications that affect the nervous system. At the same time, the liver processes many of these drugs more slowly, meaning they remain in the bloodstream much longer than they did decades earlier. A dose that once wore off overnight may now continue affecting the body well into the next day. Many older adults don't recognize this happening. They simply say things like, "I'm slowing down," or "I don't have the energy I used to." While aging certainly plays a role, medication may also be contributing. One of the biggest concerns is balance. These medications can reduce alertness, slow reaction time, and affect coordination. Even a slight delay in balance recovery can increase the chance of falling, and falls after 60 are far more serious than many people realize. A broken hip or wrist doesn't just cause pain, it often leads to weeks of reduced activity, muscle loss, and a significant decline in overall health. But there's another concern that doesn't receive enough attention. Some sleep and anxiety medications may worsen breathing during sleep, especially in people who already have obstructive sleep apnea without knowing it. During the night, breathing may become shallower, oxygen levels may fall repeatedly, and the heart has to work harder to compensate. Imagine asking your heart to climb a small hill hundreds of times every single night. Eventually, that extra effort begins to matter. This doesn't mean everyone taking these medications is at immediate risk. It simply means they deserve regular review, particularly if you've noticed increasing daytime sleepiness, morning headaches, memory problems, or unexplained fatigue. Sometimes the safest approach isn't stopping the medication completely. Sometimes it's reducing the dose, changing the timing, or exploring other treatments such as better sleep habits, cognitive behavioral therapy, relaxation techniques, or addressing underlying causes of insomnia. Now let's move to another medication group that catches many people by surprise because you don't even need a prescription to buy it: cold and sinus medications. If you've ever had a stuffy nose, you've probably used a decongestant. Medications containing ingredients such as pseudoephedrine or phenylephrine are designed to shrink swollen blood vessels inside your nose, making it easier to breathe. The problem is that these medications don't only affect blood vessels inside your nose, they can narrow blood vessels throughout the body. For a healthy young adult, this temporary effect is usually well tolerated, But after 60, when arteries are naturally stiffer and many people already have high blood pressure or heart disease, that additional narrowing may increase blood pressure and make the heart work harder. Now imagine someone who already takes medication for hypertension. They develop a cold. They buy an over the counter decongestant without realizing it may temporarily raise blood pressure. Nothing dramatic happens immediately, but the heart suddenly has to pump against greater resistance. For someone with existing cardiovascular disease, that extra strain may not be ideal. This is why it's so important to read labels carefully and tell your healthcare provider about every medication you take, not just prescriptions. Over the counter pain relievers, cold medicines, sleep aids, vitamins, herbal supplements. Everything matters because your body responds to the combination of all these products, not just one at a time. Healthy aging isn't about avoiding medication. It's about making sure every medication still fits your current health, your current body, and your current risk profile. Now, we've reached the final medication on today's list, and this one may surprise you more than any of the others because for many years it was considered one of the simplest ways to protect the heart. Millions of older adults still take it every morning without giving it a second thought. I'm talking about low dose aspirin. For decades, doctors commonly recommended a daily baby aspirin to help prevent heart attacks and strokes. At the time, the evidence suggested that reducing the blood's ability to form clots could lower the risk of blocked arteries. And for certain people, especially those who had already experienced a heart attack, stroke, or undergone procedures like stent placement or bypass surgery, aspirin continues to play an important role today. But medicine evolves as new research becomes available. Over the last several years, large clinical studies have shown that the balance between benefit and risk changes as we age, particularly for adults who have never experienced a cardiovascular event. For many healthy adults over 60, taking aspirin simply just in case may no longer provide the protection people once believed. Here's why. Your blood contains tiny cells called platelets. Whenever you cut yourself or injure a blood vessel, these platelets quickly gather together to form a clot and stop the bleeding. It's one of the body's most remarkable defense systems. Aspirin reduces the ability of those platelets to stick together. That's exactly what makes it useful for preventing dangerous blood clots inside narrowed arteries. But that same effect also means your body has a harder time stopping bleeding when it's needed. As we grow older, the lining of the stomach becomes more delicate. Blood vessels become more fragile. Small areas of irritation that once healed easily may now bleed more readily. In some people, long-term aspirin use increases the risk of stomach ulcers, gastrointestinal bleeding, or, in rare cases, bleeding inside the brain. This is why current medical guidelines emphasize something called individual risk assessment. Instead of recommending aspirin for everyone over a certain age, doctors now look at the complete picture. Have you already had a heart attack? Have you previously suffered a stroke? Do you have diabetes with a very high cardiovascular risk? Are you already taking blood thinning medication? Do you have a history of stomach bleeding? All of these factors help determine whether aspirin is likely to provide more benefit than risk. The important message isn't that aspirin is good or bad. The important message is that it must fit the individual sitting in front of the doctor. One size no longer fits everyone. And perhaps that's the biggest lesson from today's discussion. Whether we're talking about pain relievers, acid-reducing medications, sleep medicines, decongestants, or aspirin, they all share one thing in common. They were designed to help. The problem isn't usually the medication itself. The problem is assuming that because something worked 10 or 15 years ago, it must automatically remain the best choice today. Healthy aging requires regular adjustment. Think of your health like maintaining a home. You wouldn't expect the same roof, plumbing, or electrical system to last forever without inspections and maintenance. Your body deserves that same attention. One of the smartest habits you can develop after 60 is requesting a complete medication review at least once every year. Bring every prescription, every vitamin, every herbal supplement, and every over-the-counter medicine you use. Don't leave anything out. Then ask your healthcare provider a few simple questions. Do I still need every one of these medications? Is the dosage still appropriate for my age and kidney function? Could any of these medicines be interacting with each other? Is there a safer alternative for me today? Those 4 questions may be among the most valuable questions you ever ask, because prevention rarely happens through one dramatic decision. It happens through small adjustments made before problems appear. I also want to remind you of something equally important. Never stop a prescribed medication on your own after watching a video online. Every person's medical history is different. What may be appropriate for one individual could be completely wrong for another. Decisions about medications should always be made together with the healthcare professional who understands your medical history. As we finish today's discussion, I hope you take away one simple idea. Getting older doesn't mean becoming afraid of medications, it means becoming more informed about them. Knowledge gives you confidence. Confidence helps you ask better questions, and better questions often lead to better healthcare decisions. If today's video helped you understand your medications a little better, I'd love to hear from you. Let me know your age and tell me whether you've ever had a medication review with your doctor. Your experience might encourage someone else to schedule an appointment they've been putting off for months. If you enjoy practical, science-based health information designed for adults over 50, consider subscribing so you never miss future videos. Every week, we explore simple ways to support your heart, brain, muscles, joints, and overall health using evidence-based information you can actually apply in everyday life. Until next time, stay informed, stay active, take good care of yourself, and remember this: the healthiest future isn't built by taking more medications, it's built by making sure the medications you do take are still the right ones for the body you have today.